So today I want to talk about vaccinations and why that should be required for families who have new babies 12 to 15 months, um, so that in the future we can prevent and minimize severe diseases. So I want to start out with just listing some common vaccines that you've probably heard of, such as measles, mumps, influenza, polio, HPV, tetanus, like among many others. There are so many vaccines, but the benefits of these vaccines go way deeper than just a shot in a new baby. So the first one is that it can save this child's life. So say this child grows up and they don't have a vaccination for the flu and they end up catching the flu, their symptoms and the effect that it's going to have on their body is going to be way more severe than someone who has been vaccinated. There was a study in South Carolina in 2016, 94 deaths because of the flu, because of people who weren't vaccinated. And that to me is just mind-blowing. Secondly, it's safe and effective. There have been studies, researchers, scientists, doctors who have put so much time and effort into devoting themselves to creating these vaccines in order to make the world a more safe and healthy environment. Thirdly, it protects other people. Like I was talking about the flu, if you have the flu vaccine from when you're a baby and you catch it when you're older, your symptoms and the severity that it's going to have on you is going to be a lot lower than someone who isn't. And so if you give that to someone else and they weren't vaccinated, or they were, the chances of the severity that it can have on their bodies will vary. Fourthly, it saves time and money. So having vaccines done when you're a child is pretty costly, and that's something that young parents struggle with, is if it's something that's important enough to them to get it done while they're a baby or wait until later, and then they end up not getting it. So when in the future, if you develop a disease or an illness and you weren't vaccinated, there's going to be a lot more hospital bills coming your way. That's going to make your money so tight, because you're having to pay for medications and hospital visits and doctor's visits to try and get your body as healthy as can be. And another benefit, the last benefit, is that it protects our future generations. We're overall just minimizing the number of people in our country who will develop a disease that is contagious and will sicken other people. So we want to minimize that as much as possible. Some risks that were talked about and reasons why parents don't want their children to be vaccinated is because they don't trust medicine. It's something that is super serious, and they think way more time and money needs to be put into that before they just inject it into our bodies. People want a more natural way of healing and things like that. And not only that, but it is costly. Vaccines are very costly, and there is a very low chance that a child will develop some of the diseases that were listed anyway. So why put your child through that if it's a possibility that they're not even going to develop this sickness in the first place? There are some side effects that can worry parents, especially seeing their little babies, have a low-grade fever. You can see and hear the pain, and there is redness in the injection site of the baby, and that can cause parents to freak out. Some more serious side effects are seizures and neurological defects. And there are studies to explain that way more in depth than I could. So currently, our world is dealing with COVID-19, coronavirus, and there is talk every day about a vaccine for that. And questions are raised about whether they're going to make that a requirement for children to have when they're born. And we've seen in our society the way that this illness affects people. Some people, it's not that bad. Some people, they do die from it, and it's very serious. It's a very serious matter, and you don't want to take it lightly. But a question that may be raised for the coronavirus vaccine is, if it proves it's effective against the coronavirus, will people be required to get this? Yes or no? So, reasons why vaccines shouldn't be required can go on, but overall, the reasoning for vaccines being required outweighs the reasons that it shouldn't so heavily that it will overall affect not only that specific person's health, but overall our whole country. If everyone was required for these medical treatments, all of our health would be so much better. And that is why I think that these vaccines should all be required.